Okay. Hello, everybody. Good afternoon. Welcome to our first NHAD webinar of 2020. And thank you all for taking the time to be here during these hard and difficult times that we are living these days amid the COVID-19 pandemic. I hope all of you are doing well, as well as your family and loved ones, and staying safe. My name is Luis Alberto Mares, and I am the Director of Community Mobilization at the Latino Commission on AIDS, responsible for organizing and coordinating the National Hispanic Hepatitis Awareness Day, NHAD, and also the National Latino AIDS Awareness Day, and that happens in October. I have been working at the Latino Commission on AIDS for over 3 years now. Previous to that, I was the director of the YMCA Transitional Housing Program in Queens, New York, where we provided temporary housing to homeless individuals living with HIV. And previous to that, in my native Peru, I worked as a general practitioner physician for 4 years. I graduated from medical school at Universidad Peruana Gaitán de Heredia in Peru in 1993, and recently got my master's in social work in NYU, New York University, in 2017. Today, I will be presenting about viral hepatitis and hepatitis vaccines. But first, a little bit of housekeeping. Everyone has been mute, so we don't hear background noise. The webinar is being recorded, and please use the chat box function to write your questions and comments. There will be time at the end, of course, of the webinar for questions. Okay, so the objectives of this webinar, at the end of this webinar, hopefully we can have a clear concept of what viral hepatitis is and the different types of viral hepatitis, how they are transmitted, and what symptoms can be present when they are present. I'm sorry. To have a clear idea of what is a vaccine and what type of vaccines we have for hepatitis, and to know which hepatitis can be prevented by vaccine and which can be cured. This webinar is going to be divided in 3 sections. A first few slides about NHAD and hepatitis in Latinos. A few more slides about vaccines, definition, type of vaccines, and how they work. And finally, most of the webinar is dedicated for viral hepatitis, definition, and the types A, B, and C. This is working slowly, I'm sorry. Okay. Okay. National Hispanic Hepatitis Awareness Day. Um, the National Hispanic Hepatitis Awareness Day was created in 2012 by the Latino Commission on AIDS in a joint effort with the Hispanic Federation in response to the impact of viral hepatitis on the Hispanic community. It was established to bring attention to the importance of testing, prevention, and treatment of viral hepatitis among Latinos, and NHAD happens every year on May 15, in the middle of the Hepatitis Awareness Month and just before the National Hepatitis Testing Day. This is its 9th version. Some of you may have followed NHAD in the previous years, and you can see some of the posters that we have created for previous campaigns. 2 last ones are the ones that I've been part of. For NHAD and the Latino Commission on AIDS, it is important to create awareness about the disparities that affect the Latino community around hepatitis. We know that we Latinos do not represent a big, small portion of the cases of hepatitis in the United States. But even though we represent only a small portion, for example, only 4% of cases of hepatitis C, if we get infected with hepatitis, our chances of dying of it are higher, are 60% higher than it is for whites. In 2016, the rate for hepatitis C deaths for Hispanics was higher than the national average. This means that hepatitis C kills more members of our community, the Latino community, than it does among other communities. We also know that chronic liver diseases and cirrhosis are the 7th leading cause of death among Latinos, as compared to the 12th among whites and 15th among blacks. And we also know that the most common cause of chronic conditions of the liver, cirrhosis, and liver cancer is viral hepatitis. In this slide, we can see that in the past years, we have seen an increase, a very important increase of mortality by viral hepatitis among African Americans and Native Americans and Alaska Natives. But despite these increases, the rates among Latinos were always higher. The red line in the graphic is the Latinos, has always been higher and remains higher than the rest. And it is also reported that unfortunately, vaccination for hepatitis B among Latinos is lower than in other communities. Because of all this data among Latinos, we at the Latino Commission on AIDS, in partnership with different agencies and through our National Hispanic Hepatitis Awareness Day campaign, are committed in increasing awareness about hepatitis among Latinos, bringing attention to the importance of screening prevention, vaccination, and treatment for this condition, developing material that is culturally and linguistically sensitive. This year, 2020, we have focused our campaign in delivering a message of prevention and the use of vaccines to prevent viral hepatitis. Preventing viral hepatitis is easy. It is as easy as ABC. That's our slogan this year. We want to make our community and our people in the Hispanic community to know that preventing hepatitis is not difficult. I mean, we can go to the doctor and get vaccinated, and that's it, and we are preventing hepatitis. So A, get vaccinated to prevent viral hepatitis A and viral hepatitis B. B, avoid sharing needles to prevent hepatitis C, and C, seek treatment for viral hepatitis C and get cured. Okay, so before getting into viral hepatitis, let's talk a little bit about vaccines in general. What are vaccines? Vaccines are like a training course for the immune system. They prepare the body to fight diseases without exposing to the disease symptoms. Vaccines are specific for certain infectious diseases and are basically biological preparations that will produce acquired immunity to a particular virus or bacteria. What a vaccine does is to stimulate the immune system to produce antibodies exactly as if you were exposed to the disease. After the threat has passed, many of the antibodies will break down, but immune cells, called memory cells, remain in the body. So in this image, we can see how a weak or dead germ, form of the germ, and sometimes a particle part of the germ, is part of the vaccine that is introduced in our body, and this will spark our immune system to respond and develop antibodies that will remember the germ. So in the future, when the germ invades our body, the antibodies will fight the germs with the memory that has been created. There are several types of vaccines, but the three that are more common are live attenuated vaccines, inactivated vaccines, and subunit conjugated vaccines. Live attenuated vaccines use weakened or attenuated, as the name says, form of the virus. Because these vaccines are so similar to the natural infection, they create a strong and long-lasting immune response. Just 1 or 2 doses of a live vaccine can give us a lifetime of protection against the germ and the disease that it causes. But because they contain live viruses, they are not indicated in people with very weakened immune systems, like people receiving treatment for cancer, or people with HIV, that a late stage of HIV, or immune diseases that compromise the immune system. Examples for these attenuated vaccines are measles, mumps, and rubella, rotavirus, smallpox, chickenpox, yellow fever, and typhoid fever. Another type of vaccines are inactivated vaccines. These vaccines use the killed version of the virus that is causing the disease. The immune response this type of vaccine generates is not as strong as the live ones. Therefore, several doses are needed. Examples of these vaccines are hepatitis A, influenza, polio, rabies. And another type of vaccines called the subunit, recombinant, or conjugated vaccines uses specific parts of pieces of the germ, like a protein, a sugar, or a capsid, which is the surrounding casing of the virus. These vaccines produce a very strong immune response directed to a specific part of the germ, but boosters are usually required with these type of vaccines. Examples are hepatitis B, human papillomavirus, pertussis, shingles, and also for bacteria like Haemophilus influenza, pneumococcal, and meningococcal. Okay, so now that we have a little more clear idea of how vaccines work and what they are, let's talk about viral hepatitis and the vaccines that we have for hepatitis. First, as the image here shows, the term hepatitis is composed by two Latin words, hepato and itis. Hepato means liver, and itis means inflammation. And the fact that it's a viral hepatitis, it determines that it's the virus that is causing it. So, viral hepatitis, therefore, refers to an infection caused by a virus that is causing liver inflammation and damage. There are, of course, other causes of liver inflammation different to viruses, such as alcohol abuse, drugs and toxins, parasites, some other bacterial infections, fatty liver disease, autoimmune diseases, and some genetic diseases. In this webinar, we will focus on viral hepatitis, the one that is caused by virus. The initial symptoms for all types of hepatitis are similar, and we will touch about the symptoms in later slides. Researchers have discovered several different viruses that cause hepatitis, including hepatitis A, B, C, D, and E. And I think now it's also hepatitis G. On this presentation, we will focus only on the three main and more known causes that cause hepatitis. Hepatitis A virus, hepatitis B virus, and hepatitis C virus. Let's note that hepatitis D only happens when a person is already infected with hepatitis B, and hepatitis E is not so common and it's very similar to hepatitis A. Okay, viral hepatitis A. Here we see the graphic. I wanted to present the graphic for each virus so we know that these viruses are different from each other and they are not related to each other, even though they cause similar symptoms and similar clinical syndromes. So viral hepatitis A is the virus that the hepatitis A virus is the most common cause of hepatitis around the world. It is an RNA virus belonging to the picornavirus family of viruses. Viral hepatitis A is an acute and short-term infection. This means people usually get better without treatment after a few weeks. In very rare cases, hepatitis A can be severe and lead to liver failure. And in these cases, there will need to be hospitalization and sometimes even to get to an emergency liver transplant in order to prevent death of the patient. Hepatitis A does not lead to long-term complications, such as cirrhosis, because as I mentioned, the infection only lasts a short time. This virus is transmitted from person to person, and the transmission is mostly by fecal-oral route. The hepatitis A spreads through contact with an infected person's stool. Contact can occur by eating food made by an infected person who did not wash his or her hands after using the bathroom, by drinking untreated water or eating food washed in untreated water, by placing our finger on an object that has been contaminated with a disease, a person's stool that is infected, or by having close personal contact with an infected person, such as having sex or caring for someone who's ill. Now, in the United States, hepatitis A has become relatively uncommon with time. After the hepatitis A vaccine became available in 1995, the rate of hepatitis A infections declined by 95% in our country. The number of reported cases of hepatitis A fell to almost 1,200 in the year 2014, the lowest yearly number of cases reported since the disease could be tracked. However, the number of reported cases increased to almost 3 times in 2017, mostly due to outbreaks among people who use drugs and people experiencing homelessness. It is suggested that the number of cases and outbreaks of hepatitis A continue to increase through 2019. Now, we all are at risk of getting hepatitis A, but who is at an increased risk for acquiring hepatitis A infection? Persons with direct contact with people that are already being infected with hepatitis A, men who have sex with men, users of injection and non-injection drugs, people who live in homelessness, and jail inmates or people who have recently been in jail. But also other people that are in risk because of their occupation, like persons working with non-human primates, travelers to countries where hepatitis A is highly endemic, household members of other close personal contact with children that being adopted for those countries where hepatitis A is highly endemic. Okay, so what happens when we get hepatitis A? These are the symptoms that appear. Usually, people will present symptoms. Children, among older children and adults, infections typically present symptoms. So we will see these things happen in people who is infected with hepatitis A. The symptoms are most commonly fever, fatigue, loss of appetite, nausea, vomiting, abdominal pain, dark urine, diarrhea, pale stools, joint pain, and this classic discoloration of the skin and the mucosas, this yellowish, is called jaundice. And this happens because of the increase of bilirubin in our blood. Um, Most infections in children younger than 6 years old are not accompanied by symptoms. Children mostly are asymptomatic. When symptoms are present, young children typically do not have jaundice. Jaundice is most common in adult people. And when they occur, how long are they going to last? Symptoms of hepatitis A usually last for 2 months, although in a few cases, they can persist for up to 6 months. Again, this is an acute infection, and it does not become chronic. Also good to know is that the incubation period for hepatitis A is an average 28 days. It goes from 15 to 50 days. Now, prevention and treatment for hepatitis A. There is currently no cure for hepatitis A, but it normally gets better on its own within a couple of months. Most of the times you can usually look after yourself at home, but it is still a good idea to see your doctor for a blood test if you think you could have hepatitis A, because more serious condition can have similar symptoms. So it's better to be sure that it's one thing, hepatitis A, or whatever else is happening. Your health provider can also advise you about treatment, and they will carry on regular blood tests to see how your liver is working. To relieve your symptoms, your doctor can give you some indications like to get plenty of rest, especially during the initial stages of the infection, because people usually feel very, very tired. Painkillers are not always indicated, but can be taken if necessary, because we try to diminish the use of the liver, and most of the time medications are metabolized by the liver. So also to reduce the itching, indications of maintaining a cool, well-ventilated environment, wearing loose clothes, and in some cases you can be recommended to use antihistamines for the itching. It's also recommended to eat small, light meals to help reduce the nausea and vomiting. And if it's necessary, medication can be given for that, antiemetics. And definitely it's indicated to avoid alcohol. Drinking alcohol can put additional strain on your liver. It's also important that a person that is infected with hepatitis A prevents the spreading of the infection. So while the person is ill, the person should stay off of work or school until at least a week after the yellowish coloration of the skin and other symptoms have started. This person should avoid preparing food for other people, wash their hands with soap and water regularly, wash the toilet, clean the toilet once it's used, avoid sharing towels. Laundry should be separately, and avoid having sex all the time that the person is infectious. So the most effective way to prevent hepatitis A is the use of hepatitis A vaccines. As we mentioned, the main topic of this year campaign is to use vaccines, so we're going to focus on hepatitis A vaccine and hepatitis B vaccine. The hepatitis A vaccine is an inactivated vaccine. It means it's made from kill virus. In the United States, we have been using these vaccines since 1995, and this vaccine has proven to be highly effective, being reported in some studies up to 100% of effectiveness. Indications for hepatitis C vaccine. Who should get vaccinated for hepatitis A? You should get vaccines for hepatitis A if you are traveling to countries where hepatitis A is common, if you're a man who has sex with other men, if you use illegal drugs, if you have a chronic liver disease such as hepatitis B or C, just to prevent getting another disease on top of the ones that you have. If you are being treated with clotting factors concentrates, if you work with hepatitis A infected animals or in a hepatitis A research laboratory, or if you expect to have close contact person with people that is coming from places where hepatitis A is highly endemic. Administration and doses of hepatitis A vaccine. Hepatitis vaccine administered by injection, intramuscular injection, usually in the muscle of the shoulder, the upper arm. 2 separate shots of half a milliliter for children and a milliliter for adults are required and should be given between 6 to 12 months apart. Both shots are needed for long-term protections. Hepatitis A vaccine may be given at the same time with other vaccines. There is no problem with that. And alternatively, everyone over the age of 12 months who wishes to be protected from hepatitis A virus can be vaccinated at any time. Travelers are advised to get vaccinated at least 2 weeks before traveling. The hepatitis A vaccine is safe. No serious side effects have been reported from the hepatitis A vaccine. Soreness of injection site is the most common side effect reported. And we also know that since the use of the first hepatitis A vaccine in 1995, millions of doses of this vaccine have been given in the US and the worldwide without serious side effects. So now, hepatitis B. Again, you see the image of this virus is completely different from the hepatitis A virus. Hepatitis B is a liver infection caused by hepatitis B virus, which is a double-stranded DNA virus belonging to the Hepatitidinae family. This is a blood-borne virus, which means it's transmitted when blood, semen, and other body fluids from a person infected with virus enters the body of someone who is not infected. This can happen through sexual contact, sharing needles, syringes, or other drug injection equipment, or also from mother to a baby at birth. For some people, hepatitis B is a short-term illness, but for others, it can become a long-term or chronic infection. Chronic hepatitis B can lead to serious health issues like cirrhosis or liver cancer. And the best way to prevent hepatitis B is by getting vaccinated. Okay, as I mentioned, hepatitis B can be acute or chronic. Acute hepatitis B is a short-term infection. If you have symptoms, they may last several weeks. In some cases, symptoms last up to 6 months. Sometimes your body is able to fight off infection and the virus goes away. Most healthy adults and children older than 5 years old who have hepatitis B get better without treatment. Chronic hepatitis B is a long-lasting infection. Chronic hepatitis B occurs when your body isn't able to fight off the virus and the virus does not go away. Your chances of developing chronic hepatitis B are greater if you are infected with the virus as a young child. About 90% of infants infected with hepatitis B develop a chronic infection. About 25 to 50% of children infected between the ages of 1 and 5 years develop chronic infections. However, among people infected during adulthood, only about 5% develop chronic hepatitis B. So, symptoms of hepatitis B. Some people infected with hepatitis B have no symptoms at all. Some people, around 50%, if they are older than 5 years, will present symptoms of acute hepatitis B within 2 to 5 months after they come in contact with the virus. Infants and children younger than 5 years typically do not have symptoms with this infection. When the symptoms are present for acute hepatitis B, I'm sorry, they may include several that we have seen with hepatitis A. Dark yellow urine, feeling tired, fever, gray or clay pale stools, joint pain, loss of appetite, nausea, abdominal pain, vomiting, and the yellowish discoloration of the skin, that we call jaundice. These symptoms, if present, may last for several weeks. On the other hand, patients with chronic hepatitis B may not have symptoms until complications are developing, which could be decades after they are infected. For this reason, hepatitis B screening is very important, and even if there is no symptoms. As the chronic infection progresses, compromising the liver function, symptoms appear in relation to the degree of the fibrosis of the liver. More fibrosis, more symptoms. Some of these symptoms are related with retention of liquids, shown as edema on the lower limbs, and ascites, which is a collection of liquids in the abdominal cavity. There's skin symptoms, as again, the discoloration, the yellowish discoloration of the skin, pulmonary erythema, and itching, which is called pruritus, and is caused by the elevated levels of bilirubin in the blood. The continued process of scarring and fibrosis produce portal hypertension, which will cause the appearance of gastroesophageal varices. The veins around the junction between the esophagus and the stomach will become varicosal, and this will eventually produce bleeding. As the liver gets more damaged, coagulation is affected because the liver produces coagulation factors, and toxin levels are elevated in the blood, and they will eventually produce hepatic encephalopathy. Our brain will start to shut down as well. The management of these symptoms are specific for each one, and they're able should be managed by a specialist physician in the hospital. It is in the States, it is estimated that there are up to 2.2 million people living with chronic hepatitis B in our country, and approximately more than half of them do not know they have it. This is why it's very important to promote screening and testing for hepatitis B. Hepatitis B in the States is more prevalent among African Americans and Asian Americans. Now, what populations are at risk? Although anyone can get hepatitis B, some people are at a higher risk than others. And these include infants born to infected mothers, people who inject drugs or share needles, syringes, or other drug equipment, sex partners of people with hepatitis B, men who have sex with men, people who live with a person who has hepatitis B, healthcare and public safety workers exposed to blood on the job, patients of hemodialysis. So because of this, sorry, the CDC recommends hepatitis B testing or screening for the following people, which is almost the same. People who were born in countries where hepatitis B is prevalent, people born in the United States, no vaccinated infants whose parents were born in these countries, men who have sex with men, people who inject drugs, people with HIV, household or sexual contacts with people living with hepatitis B, people requiring immunosuppressive therapy, people with end-stage renal failure requiring hemodialysis, people with hepatitis C, people with elevated liver enzymes in blood tests, pregnant women, and infants born to women that are infected with hepatitis B. Can we prevent hepatitis B? Yes. Luckily, we can do that with the use of vaccines. There are vaccines against hepatitis B specifically. Also, the chances of hepatitis B infection can be reduced by not sharing drug needles or drug materials, wearing gloves if you're going to touch another person's blood or open sores, making sure that the two artists or body piercers use sterile tools, not sharing personal items such as toothbrushes, razors, or nail clippers, and using condoms during sex. Can hepatitis B be treated? There is no specific treatment for acute cases of hepatitis B. During this short-term infection, doctors usually recommend rest adequate nutrition, and fluids, although some people may need to be hospitalized. On the other hand, chronic hepatitis B infection can be treated with medicines, including oral antiviral agents like tenofovir, Biuret, entecavir, varaclude, and telbibudin, Kaiseca. There is no cure for this condition. Even though there is treatment, antiretrovirals, there is no cure yet. But treatment can slow the progression of cirrhosis, reduce incidence of liver cancer, and improve long-term survival. However, not every person with chronic hepatitis B needs to be on medication, and these medications can also cause side effects in some patients. We also know that once a person starts treatment, he or she will mostly need to be on this medication for life. Vaccine for hepatitis B. The first vaccine for hepatitis B was approved in 1981, and it was an inactivated vaccine made of plasma of donors. But in 1986, research resulted in a new generation of genetically engineered DNA recombinant hepatitis B vaccine, more effective and safer than the previous one. This vaccine is 95% effective in preventing infection for hepatitis B virus, the development of chronic hepatitis B, and liver cancer due to hepatitis B. The hepatitis B vaccine is also known as the first anti-cancer vaccine because it prevents hepatitis B, the leading cause of liver cancer outside. So it doesn't prevent cancer directly, but indirectly, because it's preventing people from getting hepatitis B, it's preventing the development of liver cancer due to hepatitis B. Protection with this vaccine lasts at least 20 years and is probably lifelong. So who should get vaccinated against hepatitis B? The World Health Organization and the CDC recommend hepatitis B vaccination for all infants, all children and adolescents younger than 19 years old of age who have not been vaccinated, people at risk for infection by sexual exposure, people whose sex partners have hepatitis B, people seeking evaluations of treatment for sexually transmitted infections, men who have sex with men, people at risk for infection by exposure to blood, like for example, people who inject drugs, people who live with people and other persons who have hepatitis B, healthcare and public safety workers at risk for exposure to blood or blood-contaminated body fluids, hemodialysis patients. Also, international travelers to countries where hepatitis B is common, people with hepatitis C, people with chronic diseases of the liver, people living with HIV, people who are in jail or in prison, and whoever wants to get vaccinated looking for protection from hepatitis B as well. Doctors most often give the hepatitis B vaccine in 3 shots over 6 months. You must get all 3 shots to be fully protected. When it is given in 3 shots, the first 2 shots are given 1 month apart, and the next shot is given 4 months after, so a total of 6 months. There is also available in 2 shots, different preparations, which are administered a month apart from each other. There is also combination vaccines for both hepatitis A and B, and this combined hepatitis A and B vaccine is usually given in 3 different doses over a 6-month period. Hepatitis C. Again, you can see the image here is different from hepatitis A and B. This is just to reinforce the idea that these viruses are different from each other, different families and different compositions. That's why one vaccine is specific for just one virus. The hepatitis C virus is a small envelope single-strain RNA virus from the family Flavividae. The hepatitis C virus is the cause of hepatitis C and some cancers, such as liver cancer, and is also related to some lymphomas in humans. This virus is also a bloodborne virus and is transmitted mostly by contact with infected blood. People can become infected with hepatitis C virus in activities such as sharing needles, syringes, or other equipment to prepare or inject drugs, needle stick injuries in healthcare settings, and being born to a mother who has hepatitis C. Less commonly, a person can also get hepatitis C virus through sharing personal care items that may have come in contact with another person's blood, such as razors or toothbrushes, having sexual contact with a person infected with the hepatitis C virus, and getting a tattoo or body pierce in an unregulated setting. Hepatitis C can range from a mild illness lasting a few weeks to a serious lifelong illness. Hepatitis C is often described as acute, meaning a new infection, or chronic, meaning a lifelong infection. And there is no vaccine to prevent infection by hepatitis C virus, but there is treatment and there is a cure for it. Acute hepatitis C occurs within the first 6 months after someone is exposed to the hepatitis C virus. Hepatitis C can be a short-term illness, but for most people, acute infection leads to chronic infection. In the small proportion of people who get sick during the acute infection, signs and symptoms include some of those that we have already seen and described for hepatitis A and B: jaundice, dark urine, white colored stools, nausea, pain in the upper right of the abdomen. These signs and symptoms last for at least 12 weeks. Chronic hepatitis C can be a lifelong infection with the hepatitis C virus if left untreated. And this can develop into chronic hepatitis C and can cause serious health problems, including liver damage, cirrhosis, scarring of the liver cancer, and even death. Many people eventually develop chronic liver disease, which can range from mild to severe. And chronic liver disease in people with hepatitis C usually happens slowly, without any signs and symptoms over several decades. And that's why many people qualify hepatitis C as a silent killer, the silent um, epidemic of that is killing millions of people in the world in the United States. Mostly chronic hepatitis C virus infection is often not recognized until people are screened for blood donation or from a normal blood test found during routine examination. In this graphic, we can see the progress of liver damage caused by chronic hepatitis C. This is a slow process that can take decades to happen. And as we have already stated, most of these patients won't develop any symptom until late stages of compromise. Hepatitis C is a major cause of cirrhosis and liver cancer and the most common reason for liver transplantation in the United States. How common is hepatitis C in the country? In 2017, a total of 3,216 cases of acute hepatitis C were reported to CDC. But since many people may not have symptoms or don't know they are infected, their illness is often not diagnosed or reported, and therefore can be counted. CDC estimates the actual number of acute hepatitis C cases for that period of time was closer to 44 or 45,000. Now, hepatitis C, chronic hepatitis C is a different story. There are an estimated of 2.4 million people living with hepatitis C in the United States. And the bad part of this is that most people don't know they are infected. As we mentioned, it takes years, decades to show symptoms. So many people living with chronic hepatitis C, they don't know. And this is, again, very important to promote testing, even if there's no symptoms. Who is a risk? Who is a risk for having hepatitis C? Again, anyone can get it, but people are more at risk when they are current or former injection drug users, including those who have injected only once many years ago. Recipients of clotting factors concentrates before 1987, and recipients of blood transfusion or solid organ transplant before July 1992. Patients in hemodialysis, people with known exposure to hepatitis C virus, healthcare workers, recipient of blood organs, people living with HIV, children born to mothers infected with hepatitis C, people who are incarcerated, people who use intranasal drugs, and people who receive body piercings or tattoo done with non-sterile instruments. So, can we prevent hepatitis C? Unfortunately, as we mentioned, there is no vaccines for hepatitis C, not yet. And similar to hepatitis B, there are certain measures that people can use or can be used to help prevent getting hepatitis C. Not sharing drug needles or other drug materials. Wearing gloves if you have to touch another person's blood or open sores. Making sure your tattoo artist or body piercer uses sterile tools and an open ink. Not sharing personal items such as toothbrushes, razors, or nail clippers. Early detection and treatment are the best ways to prevent the more serious complications from hepatitis C. Therefore, CDC recommends testing for all adults older than 18 years old at least once in their lifetime, and for all pregnant women during each pregnancy. CDC also recommends testing for all persons with risk factors and continue testing for those with ongoing risk. This again includes people who have ever injected drugs or shared needles, people living with HIV, people who have ever received maintenance and hemodialysis, people who has abnormal liver test functions, people who receive concentrates chlorine factor concentrate before 1987, and people who receive transfusion before 92, people who receive organ transplant before 92, people who are notified they have received blood from a donor with a hepatitis C infection, healthcare, emergency medical and public safety personnel, children born to mothers with hepatitis C, and any persons who request hepatitis C testing. So even though there is no vaccination for hepatitis C, there is treatment, and that's a good thing in terms of hepatitis C. Give me a second. Recent advances in the number of and types of medications available to treat hepatitis C give you and your doctor more options to consider when deciding a treatment plan. These advances have made treatment regimens shorter in duration, less difficult to tolerate, and more effective. There are several newer medicines called direct-acting antiviral medicines that have been approved to treat hepatitis C since 2013. Studies show that these medicines can cure chronic hepatitis C in most people with the disease. I'm not going to discuss here what medications we have. You can see in the image here presented how in 50 years from the discovery of hepatitis C until now, medicine has progressed so widely that we now can cure hepatitis C. Medications have changed. Treatment for hepatitis C has existed since late 90s in early 200s, but it was in the beginning with ribavirin and interferon, and the treatment was not as successful as they are now, that we have a wide variety of medications and treatment can be taken orally, and the cure rate is higher and symptoms, side effects are less. Finally, in this slide, we can appreciate the progression of the effectiveness of treatment with hepatitis C. As I mentioned before, the first hepatitis C drugs only had 30% of sustained virological response. Now, today, we have 90%, 95%, which is what we call cure, sustained virological response. People with an 8 to 12 week treatment will get cured. Okay, so before finishing this presentation and going to the questions, I would like to invite all of you to join us and HEPFREE, New York City HEPFREE Twitter chat tomorrow, May 14 at 1 p.m., commemorating Hepatitis Awareness Month, National Hispanic Hepatitis Awareness Day, and National Hepatitis Testing Day. It will be hosted by the Twitter handle of the Hispanic Federation. And if you go to that link, you will find all the information that is needed to that Twitter chat and the questions that are going to be asked so you can prepare yourself before of it. And also, I would like to invite you to our second webinar. It's going to happen Friday, May 15 at 2 p.m. It's in collaboration with NHHAD, and we will be talking about viral hepatitis and policies impacting Latinx community. Keeping it real, addressing viral hepatitis epidemics among Hispanic and Latinx communities amid a pandemic. Okay, I'm gonna go to the chat to see if there's any question. I don't see any question here. If you have any question, please write it in the chat box. Okay, there's a question here saying, so if it is easy as ABC, why aren't people getting the vaccines and are patients getting being educated on vaccines and how they work? It's, exactly. Um, when we say it's easy as ABC, it means the fact that um, it's not difficult to go and get vaccinated. It's not difficult to go get vaccine. The reason why people is not getting the vaccines is because they do not know about it, and that's why we are promoting in this campaign this year about vaccines. I think the Department of Health and governmental um, offices are doing are working on that. I think more work should be done. Also, um, it's going to be touched on Friday, but funding is very important. Funding to create campaigns and to disseminate this information to everybody in our communities. Mariana Gutierrez is asking if hepatitis A is spread to fecal oral route, why are MSM and injection users more at risk? One of the practices MSM practice during sex is something called amilinguis, and is licking the area around the ass. So if a person is infected with viral hepatitis A, um, you can get infected through that route. Um, do you feel the number of times people have to go back to get a vaccine is a problem? Um, Yeah, absolutely, definitely. For hepatitis A and B, is 2 or 3 times. Definitely, like in any medication, like if you have to go back to the doctor to get a second shot or a third shot, it creates certain problem. People adherence, same thing as PrEP, same thing as medication for HIV or for hepatitis B. If you are not adhering to your treatment, you do not get well or you do not get cured. Um, Same thing with vaccines. If you have to get 3 shots, you do not get the 3 shots. You do not get the complete full protection. So it is a problem. Um, if you do have to go back, you you have a problem with adherence. That's a big problem. So people have to be reminded to get the 3 shots or the 2 shots that are needed. Would you say there is an that's Doris Kells. Would you say there is an element of stigma around hepatitis C? Absolutely. Um, Same thing with HIV, right? Hepatitis C. I think in our society, whenever we have to talk about sex or drugs, there's always a stigma. So people that look down for others that are living with HIV or hepatitis C. So these people always will have to have problems getting services, getting treatment, and getting and being adherent to the treatment. Definitely, stigma is something that needs to be addressed when we talk about hepatitis C and also HIV. Screaming. When will we be doing this type of webinars in Spanish? We will thank you for the suggestion. We will coordinate and we will take this in consideration. Yes, we have had an, webinars in Spanish, and we will be doing probably we can do this one in Spanish as well. We'll work on that. Thank you for the suggestion. Thank you, Marina Gutierrez. How much should the vaccine cost, and do most insurers cover the cost? I am not sure about this. I will have to, Gerard, look into that. I don't know. I'm sure they are not cheap. I'm sure insurances cover some of them, but I will have to check on that to get back at you. I'm sorry. Leonor asked if it was mentioned that pregnant women should get tested during each pregnancy, and why during each pregnancy is to check for new exposures. Exactly. That's the reason why women should test it for each, unless they are vaccinated or unless they already have some immunity. The reason why we want to test women, pregnant women, if you're pregnant, is to prevent that the children are born with hepatitis. So things can be done before or prepare for the delivery of the children and prevent that these children develop either hepatitis B or C. So every woman that gets pregnant should be tested for hepatitis during its pregnancy if the person has not been vaccinated before. Yes, I will share the slide with the participants, Nestor, definitely. David, oh, again, yes, we will. After this webinar is finalized, a PDF version of the webinar and the recording of the webinar will be shared by email with all of you who have participated. Be sure of that. Marie George is asking, it is interesting that many people do not know that they have hepatitis C. What routine labs would indicate that more testing may be indicated? Um, yeah, since many people do not know they have hepatitis C, um, as I mentioned, there is an indication for testing for hepatitis C for anybody who is at risk for hepatitis C, but also CDC now says that everybody older than I can't remember the day, but it's everybody should be tested at least once for hepatitis C in their life. So that's how it should be done. Um, I have been tested for hepatitis C a couple of times. Um, I think everybody can be tested and it's covered by insurance. Um, and when what lab tests can indicate that you should be tested? If you have problems with your liver, if your liver enzymes are elevated, if you are a person living with with HIV, or if you have hepatitis B, you can also be tested for hepatitis C. And if you are at risk for any other the reasons that I mentioned, if you're a man who has sex with men, if you use drugs, in the past it was also indicated for people who belong to the baby boomers, but now that's being open for everybody because there is a new spike of cases in younger people in the United States. So now we include everybody, not just baby boomers. And that was the last question in the, all right. So it's 2:53. Remember, please join us tomorrow in the Twitter chat and join us on Friday in the second webinar for NHAD. Thank you very much and for your attention, for being here with us, and looking forward to see you on Friday.